faculty must have expertise in the content area. The method of teaching should be compatible with the nurse's learning style. The cost per continuing education unit is also a factor to consider. And finally, the content should be relevant to the nurse's practice. And now, here's something relevant to every nurse's practice: cost management. As direct caregivers, nurses are constantly involved in determining the type and quantity of resources to use for clients. This includes supplies, staffing, and time. Nurses must know what costs are generated by their decisions and actions. Nurses should also know what things cost and how they are paid for in the organization so that they can make cost-effective decisions. In ambulatory and home health settings, nurses must be familiar with the various insurance plans that reimburse the organization. Each plan has different rules for pre-authorization, types of services covered, and approved vendors. Nurses can still advocate for clients in important ways while working within an environment of cost containment. When nurses understand reimbursement practices, they can help clients get the maximal benefit from the resources available. In hospitals, the cost of nursing care is not billed separately, but is included as part of the per diem service. This practice assumes that all clients require the same amount of nursing care. Because of this, nursing service is not perceived as revenue generating, but as an expense to the organization. Nurses can help contain costs by making sure that all possible charges are captured. Some large hospitals have reported losing more than $1 million per year in supplies that were not charged to the specific client. Nurses must know which supplies are charged to the unit and which are charged to the client. All procedures and equipment must be correctly documented so the reimbursing agency will approve the charge. Nurses must also evaluate whether or not cost-effective measures maintain standards of practice and allow client safety. They must also observe the practices of co-workers and determine whether or not they practice efficiency in using supplies and time. Here's a situation that comes up frequently. A client is being given his discharge instructions. He will need dressing changes. His wife asks for a week's worth of supplies. What is your response? How much can you give a client and family to tide them over until they can purchase their own supplies? Well, what you can or can't give the client will vary with your institution's policy and possibly with the client's insurance carrier. But in any case, you just can't give away extra supplies without running the risk of leaving the unit short of those same supplies, and without making sure that the hospital is reimbursed, such as by charging the client for each item. Find out the rules before the situation comes up. You wouldn't want your accommodating nature to contribute to your institution's financial burden. Time is a valuable resource in healthcare. Most people have to make a conscious effort to learn how to manage time. Time management affects quality of care, use of resources, organizational culture, responsiveness to clients, team collaboration, communication, decision-making, and planning. To improve your time management skills or help others improve theirs, the problem has to be identified. Common problems include getting started, sticking to a project, organizing the day, procrastinating, failing to set limits, losing information, being interrupted, working excessive hours, and not being able to leave work on time. 3 principles to help you with time management are establishing priorities, setting short-term and long-term goals, multitasking, delegating, and staying focused. A major strategy for completing projects is to limit distractions, but this is often impossible in the healthcare setting. Nurses must also plan breaks and take them to help feel refreshed and renewed. When nurses are organized and efficient in their care delivery and in scheduling and coordinating client care, the organization can operate more cost-effectively. Doing as much as possible with each episode of care is also important, as it can help reduce repeated hospitalizations. Clients who stay in hospitals extra days cost the hospital a considerable amount. Decreasing length of stay also makes room for other clients. Nurses must be efficient and can become more effective by analyzing their major work processes and eliminating areas of redundancy and rework. Automated clinical information systems that support integrated practice at the point of care also increase efficiency and improve client outcomes.
Historically, quality monitoring activities have been referred to as quality assurance, which involved evaluating a system, process, or activity based on a previously established standard. The process focused on detecting errors and inefficiency through chart audit, incident reports, direct observation, and customized audit tools. The concept used today is continuous quality improvement. This is an outcome-based process that focuses on strategies for positive change. Members of the healthcare team strive to maintain quality and improve client care. Quality improvement activities are closely tied to accountability. Quality healthcare includes appropriateness of care, timeliness, client satisfaction, effectiveness, efficiency, and safety. There are 3 aspects to evaluate: structure, process, and outcome. Standards to measure structure focus on what needs to be done to provide care. Standards include the number and qualifications of staff, resources, supplies, and productivity. Process standards describe how care should be provided and what nursing actions are used to provide care. These standards include staff satisfaction, pain management, skin integrity, client education, discharge planning, and response to unanticipated client needs. Outcome standards identify the desired results of nursing care. Examples of outcome measures are mortality rate, length of stay, adverse incidents, attainment of specific client outcomes, secondary complications, client satisfaction, and client adherence to the discharge plan. Continuity of care is evaluated to ensure that appropriate care is provided at the correct time. Quality care evaluation uses practice guidelines, evidence-based practice, protocols, and clinical pathways to establish criteria for desired outcomes. In addition, internal criteria may be developed by the organization. External sources must be adjusted to apply to an individual organization. Overall, the process is quite similar to the nursing process. Identify consumer needs, collect data, plan measurable outcomes, develop the plan, implement the plan, evaluate the plan, and the outcomes. There are 6 steps in the quality improvement process. First, the most important needs of the consumer are identified. A multidisciplinary team is established to review consumer needs and services. The team should include representatives from all areas involved in the problem. Data are collected to determine how the system currently meets the identified consumer needs. Measurable outcomes and quality indicators are established. A plan is developed to achieve the outcomes. Once a plan is selected, the process of change begins. Because quality improvement focuses on improving the system rather than assigning blame, strategies emphasize open communication and education of staff affected by the change. After implementation, data are collected to evaluate whether or not the plan resulted in the desired outcomes.